My wife was diagnosed with MS and understandably upset, but the doctor reassured her that it wasn't too serious, mentioning that he had patients with brain cancer. We ended up finding a new doctor. I was experiencing stomach pain, so my general practitioner scheduled me for an X-ray. The doctor showed me the results, and while staring directly at me said, "You're literally full of soti." During a physical, I used the word sate, and the doctor immediately perked up, asking, "Wait, I don't have to watch my language with you?" I replied no, and he visibly relaxed before loudly proclaiming, "Thank fine God," and began speaking about my health openly, though with enough swearing to make a sailor blush. He became my favorite GP, and I made sure to see him yearly until he left the practice. A few weeks ago, I started seeing a new family doctor after battling a serious case of pneumonia. The doctor began asking questions since I was a new patient and asked about my birth control. I told him I wasn't on any because my husband and I were considering another baby. His response was, "You should be on birth control, no one has babies on purpose." I was stunned, replying, "Both of my children were planned." He then said, "Oh, you have two? No time for intimacy, huh? You could just read a book and let your husband go at it for 10 minutes. I was in complete disbelief and thought, I'm here because I have pneumonia. Why is this even being discussed? I will never return. At my first gynecological appointment when I was 15, my mom had arranged it after discovering that I was sexually active. The doctor examining me had been the one who delivered me. During the exam, with my legs in stirrups, he shared how proud he was walking his daughter down the aisle. Knowing her white dress truly meant something. I didn't realize how disturbing that comment was until about 10 years later. But seriously, what a creep. I was dealing with extremely painful periods that were debilitating, and the bleeding was heavy. I had to change a super pad every hour or two to avoid leaks. 3 different doctors told me, it's normal to have bleeding and pain each month, as if I didn't understand basic female biology. I was furious. It turned out I had tumors in my uterus, which were only discovered after I angrily told Dr. Number 3, "Before I leave, I want you to note that you're refusing my request for diagnostic tests to figure out the cause of my pain." He reluctantly referred me for ultrasounds, and within 8 weeks, I was having surgery to remove the tumors. Thankfully, they were benign, and getting them removed stopped the pain, while the bleeding returned to normal. Fuck doctors. My new VA primary care doctor refuses to approve a refill for my SSRI prescription, which I've been taking for 5 years, because he claims that mental illness isn't real. Now, I have to start seeing a mental health specialist again. They were confused, asking, "You just need a refill?" I went to the doctor for pneumonia, and after my chest x-ray, the first thing he said was, "Huh, I've never seen that before. Just say something else, doc." The doctor barged into my room yelling, "Oh my God!" Then quickly followed with, "We need to get you to the hospital." She explained that the last person she saw with similar symptoms had to have a lot of their flesh removed and showed me pictures of the patient's wounds. It was absolutely horrifying. I had a spider bite on my elbow that started as a sore spot, feeling like I bumped it on something. 3 hours later, my whole arm was swollen, red, and hot, and when I bent my arm, a clear liquid poured out. There was no mistaking how serious it was. The doctor insisted I go to the hospital for a week of intravenous antibiotics, saying I might lose part of my arm despite treatment. The problem was, I had no insurance. I'd gone to the hospital first, but they turned me away. They can't legally do that, but I was young and inexperienced, so I left after being scolded by a desk clerk. I went to a walk-in clinic where this doctor was. Though she didn't hide her panic well, she saved my arm and possibly my life. For the next week, I saw her twice a day for shots and pills. She gave me free samples of medicine from her supply closet, saving me thousands of dollars. I only had to pay $100 for the first visit, despite seeing her 14 times. I think of her often, and hope life has treated her as kindly as she treated me. This happened to my mother-in-law. A doctor called her at 5 p.m. on a Friday to inform her that she had terminal cancer, that it would kill her in 3 months, and any doctor who told her otherwise was lying. He hung up without another word, and when she tried to call back, he didn't answer. She passed away 18 years later from a heart attack, waking up after emergency surgery for a ruptured appendix. Doctor, pick 3 of your favorite foods you'd love to eat right now. Me. Pizza, steak, wings. Doctor, that all sounds great. Too bad you won't be able to eat any of that for at least a week. Yes, this surgery has a 5% chance of causing incontinence in men, but I'm not sure what effect it has on women. Sir, I am a woman. If you don't know how this surgery will affect critical organs, then you're not touching me. I asked my new doctor a simple follow-up question about his diagnosis, and he immediately became defensive, shouting, "I'm the doctor here! I went to med school! You spent a few minutes on Google and you're going to question me?" Needless to say, I went home and found a new doctor after Googling the situation. I'm a guy, and I have a female Indian doctor. She's had enough of people's nonsense, and I'm all out of patience. Every time I go in, we joke around. Me. Just returned from Thailand, her cool, head downstairs to the lab. I've already ordered your STD test since I saw your name. Get out of here. Lol, thanks. My period was late, so I went to a doctor to see if I was pregnant. I'd taken a few tests that seemed positive, and something just didn't feel right. I went in, peed in a cup, and was in the exam room for less than a minute. The doctor came in, looked at me and asked, "You here for a pregnancy test?" I said yes. He replied, "Yeah, it's negative," and started to leave. I asked, "Wait, I have questions. What could make me 2 weeks late?" He shrugged and said, "I don't know, are you stressed?" "Could be your age." I replied, "SIR. I'm 28. He then asked, "Do you want to get pregnant?" I said, "It wouldn't have been planned if I had been." He then responded, "Well, I guess you got lucky then." My non-pregnancy turned 7 in March, and she's my favorite person. Turns out that doctor lost his medical license for sexually assaulting his patients. In my 20s, I had severe endometriosis. I'd already had 4 surgeries to remove it, including losing 1 ovary in the process. I had lived with sharp pain for 5 years. Despite my wishes, a doctor refused to perform a hysterectomy, saying that my future husband might want children. He felt it was acceptable to hand control of my body to someone I hadn't even met. After my appendix burst, the doctor sent me to the hospital immediately. When we arrived, a doctor dismissed it, saying, "Oh, it's just a young kid faking it. Take him home, give him some Panadol, water, and let him rest. He'll be fine." Later that night, I couldn't walk and was rushed back to the hospital, where surgery was prepared immediately. When I was 14, I had a yeast infection. An elderly male doctor told me to stop inserting things like hairbrushes inside me. I mentioned to my doctor that my bottom sometimes gets irritated. He said I could schedule an in-person appointment to get it checked, but warned me to avoid doing so virtually. He mentioned that a patient once scheduled a video call and showed him their bottom with an iPad camera. My new doctor asked if I could be pregnant. I jokingly said, "No need to worry about that because I'm a card-carrying lesbian." A week later, I checked my online medical chart, and it clearly said, "Patient is a card-carrying lesbian." Too funny. I went to get diagnosed with depression so I could start seeing a psychiatrist. The doctor told me to just get a girlfriend. Sure, I'll just pick one up from the store on the way home. A doctor told me the tumor on my spine couldn't be causing pain because there are no nerves in or near the spine. I pointed out that it's the central part of the body and filed a complaint. Not directly to me, but I went in to ask for a referral for a breast reduction and brought my boyfriend, now husband, along. The doctor completely ignored me and asked if my boyfriend, who I'd been dating for about 6 months, was okay with me having a reduction. He said, "I don't care. It's not my body. Why are you asking me?" The doctor then refused, saying I might regret it because most people prefer larger breasts, so I should just suffer. Maybe that's true for big breasts, but not for the kind I was dealing with. I went to a hematologist to get clearance for a hysterectomy because I was dealing with heavy, painful, 9-day periods every 2 weeks, plus constant inflammation and anemia. My husband came with me, and I was 26 at the time and didn't want kids. The doctor asked my husband if he was okay with the decision, and he responded, "It's her body, and she gets to decide. I support whatever choice she makes." The doctor, clearly expecting my husband to disagree, said, "You're too young to know what you want, and even though your husband supports it, what if he dies and your next husband wants children?" He refused to approve my request. I reported him to the hospital and board and found another doctor. My orthopedic surgeon used to work for an NFL team. After my rotator cuff surgery, he said, "Look, I put your marine tattoo lines back perfectly." He was an awesome guy. My husband went to a doctor about chronic back and neck pain when he was in his 20s. The doctor examined him briefly, then diagnosed him with myotonic muscular dystrophy. He told him there was no real treatment, and that he'd likely be in a wheelchair in a few years. He referred him to a specialist, We were newlyweds and very active. My husband worked as a mechanic, doing physical labor. We were devastated. A few weeks later, the specialist told him the first doctor was completely wrong. They did genetic tests and confirmed he didn't have it. It turned out he had mild scoliosis and arthritis. Screw that first doctor. I'm a hemophiliac and have to wear a medic alert at all times in case of accidents, injuries, or unconsciousness. I used to wear a dog tag, but as I got older, it started pulling on the chest hair I'd worked hard to grow, which was really annoying. I switched to a bracelet instead. When I saw my hematologist for the first time since the switch, he made a comment about the importance of wearing a medic alert. I told him I upgraded to a bracelet, and his blunt response was, "You could lose your arm and still live without the medic alert. But if you lose your head, it's irrelevant because you'll be dead." Touché, doc. Touché.